Tell the people inside that little circle how the heck you came up with this and what its benefit to the patient experience is going to be.
Okay, so this was first a concept to restore the tension band in the back part of the spine. And it turns out that can be clinically useful for a variety of different reasons, but the main one is for patients with a problem called degenerative spondylolisthesis. And that's a problem in which the upper vertebra slides forward, back and forth on the lower vertebra, and it ultimately results in compression of the nerve. So that is usually treated in the United States with a fusion as well as a decompression, because they present with instability. The fusion deals with the instability, the decompression deals with the nerve compression that the patients present with. So we developed this device as a different way of dealing with that same problem. And one of the things we're talking about here is the results that we've seen in our clinical study, which will hopefully result in the device being approved at about the end of December of this year.
Am I correct in understanding this device is going to be motion preserving and anatomy preserving, correct?
Yeah, that's correct. So it relies on a couple of things. Number one, the surgeon's ability to do a direct decompression, so to take the pressure off the nerve roots using a microscope and the things that we know how to do. And then number two, the body's inherent stability that results when the segment is in more of an extended position, so that these joints called the facet joints are more engaged. That allows the spine. This was actually approved in Europe first, and there were over 2,000 surgeries done in Germany, and it's currently the FDA is currently in the process of evaluating our application for a formal approval here in the United States. It's a PMA device, so we had to do a 300-person trial with 2 years of follow-up, including a control group in which the patients with this instability problem, degenerative spondylolisthesis, had a lumbar fusion. So in the control group they had a fusion, in the experimental group they had a decompression with the device.
I didn't even realize you were that far along. That's awesome.
It's been a
impressive.
very
And
long
congratulations to all of you. What's the return to I'm taking normal walks after I get this around the block?
So it's around 6 weeks.
Huh.
Until you're basically feeling over the effects of surgery. We've got some really good return to activities of daily living and return to work data that shows that it's far faster than having undergone a lumbar fusion.
That's excellent. I mean, congratulations. I think it looks simple, and I'm attracted to simple.
The reason this was able to be relatively simple is that it is an indirect method of achieving stability. It relies ultimately on the patient's own anatomy. It just simply repositions the segment into a position in which that anatomy can work best.
There you heard it here. Thank you so much.